President Muhammadu Buhari and the Presidential Task Force on COVID-19 approved measures tagged Phase 2 to ease the lockdown, which have been in place since March 29, 2020. These guidelines for Phase 2 from June 2nd have been reviewed and extended 3 times. The ease of lockdown protocols stipulate that the mandatory use of face masks in public, while hand washing and sanitizing practices must continue to be adhered to. The nationwide curfew remains in place, but the time was changed from 10 p.m. to 4 p.m. daily. Healthcare workers and journalists are exempted from the curfew. Meanwhile, airports were reopened for domestic flights with proper and stringent protocols in place. The second phase also witnessed the relaxation of restrictions on places of worship based on guidelines issued by the PTF and state governments. Similarly, exiting students resumed school, banks also reopened for full business transactions, markets fully reopened with a call on the citizenry to take responsibility by enforcing and practicing all protocols in place to mitigate community spread of COVID-19. There have, however, been pockets of violations, with people sometimes throwing caution to the wind. And ironically, the lockdown cannot continue forever as government tries to strike a balance between the health of the nation and the economy. The third extension of the Phase 2 ease of lockdown ends today. The question is, how has Nigeria fared in observing protocols of the ease of lockdown? Can we say it is safe to completely go back to the old normal? Welcome to the program. These issues will be discussed with our guests coming up shortly. I'm Dennis Adigunloye. Welcome. All right, joining me to review the COVID-19 Phase 2 ease of lockdown, we have 2 guests who are regulars now on this issue. We have Dr. Iheme Ogbonnaya, a consultant, family physician and medical director, Prime Care Hospital, Gwarimpa. Welcome to Nigeria Today.
Thank you, Dennis, for having me. Good evening, Nigeria.
All right, and also joining us is Atta Iharo, Chairman, FCT Ministerial Task Force on COVID-19. Welcome back to the program.
A wonderful time being with the largest network in Africa.
Sure, thank you. All right, let me come to Dr. Iheme first. Phase 2 lockdown rounds up today. What has been, or what is your general assessment of how the whole process has gone?
Yeah, thank you. I should say my assessment for the compliance has largely been very satisfactory. Especially with the enforcement, the government enforcers have really lived up to billing. They as much as possible, they have tried, got out of their ways to make sure that all those protocols that the government has stipulated towards helping us to fight as much as possible to contain COVID-19 has been put in place. Kudos to the committee that has been in charge for that enforcement, especially here in FCT. Well, I also want to say kudos also to the citizens who have also tried as much as possible in the face of various difficulties and hardships they have also been experiencing in trying to, as much as possible, observe those practices. I think by and large, even with pockets of violations like we've mentioned earlier on, I think we must have commend ourselves, both the enforcers as well as the citizens, and of course the government represented by the PTF, who have always been the ones at the forefront of rolling out the various stipulations that containing the virus.
All right, Atta Iharo, I know that you have concur with some of those observations.
Yes, I think largely I agree with Doctor, but to some extent I will be a little bit hard on us as a people. We are not medical doctors, those of us who are the enforcers, but what we do is that Doctor and his team from the medical sector will tell us what is appropriate for us going forward. That's the health protocols here, and most times it's apt that we follow them because they are the ones who have spent their time and they are the ones in the field here. They are the ones who will tell you when a pandemic breaks out and when your life is at risk and what you should do to actually make yourself and those around you very safe here. And if you observe very closely, yes, he commended us in the FCT here, but the compliance level in the second phase appeared to not be as strong as it was in the first phase, and we are hoping going forward that persons will actually take responsibility, because what we did is that in the second phase we got to do real intense advocacy here, and we observe as well that many persons outside the city center appear to still believing in this belief. Yeah, I'm not a doctor, but the doctors have told us very clearly that if we actually put on our face masks, wash our hands constantly under running waters, if we keep social distancing, the likelihood that we will not come down under COVID-19 is real. We have seen several deaths of high-profile persons here, and yet many persons within the second phase are trying to say, look, these doctors aren't telling us the truth. But that is not right here. And I think very strongly here, we had battle with nightclubs here. We did so much enforcement. The mobile courts we are working, we had battle with our religious bodies, both the churches and the mosques, who came out the first week. It was very sweet, very beautiful. Second, third, fourth week, we started to see them declining here. We had intense controversy with the market, trying to manage the market here. People struggling through, agreed that they signed even an agreement with us in the FCT that they will be abiding by the rules. But after about a week or so, we started to see persons relaxing again. And in all of this process here, the biggest challenge we got in the second phase is intense disbelief by so many persons here that COVID-19 wasn't real, or that COVID-19 had different form. In Europe, it was real. In Germany, it was in Europe, Germany, Italy, and others, it was real. In part of China, it was real. In the US, it was real. When it got here, it could not even have. These are just belief system here. But thanks to the doctors and others here who have kept us alive and kept us running, and they deserve the biggest commendation. I will say it anywhere. We are the ones who were on the field. We never had contact directly. Yeah, some of us came down. Some persons in the team, 1 or 2 or 3, came down with COVID-19. But the real persons are the doctors, the nurses, and the health workers who we are just there 24/7. Even the FCT health secretary, the man fighting it from the health angle in the FCT, Dr. Mohamed Kawo, came down with COVID. Very sad.
Yeah, well, certainly kudos to the medical staff battling this invisible enemy. Dr. Iheme, no doubt you have observed how glaring it has been, especially in the satellite towns, the lack of belief. We've touched on this last time you were here, lack of belief on the part of so many that this virus even exists. There seems to be a lot of complacency in the air right now.
Yeah, I agree with you. You know, like 1 or 2 times I found myself in the satellite towns. I was so disappointed. I mean, at the sites, at such areas. You see where people do not wear their face masks. Yes, just like the last speaker was, Mr. Atta was talking about. You know, I think it has to do with the belief system. You know, where people do not actually believe. I mean, even with all the sensitization programs the government has put into place. I mean, every day you hear jingles trying to tell people how real COVID-19 is as far as this country is concerned. I mean the cases, the high-profile personalities we've lost over time, people in government, and so on and so forth. Celebrities that have also come down with the sickness. I mean, this is enough to spread the gospel around that COVID-19 is real. But it's so unfortunate that people choose to still endorse that belief that COVID-19 is a scam. So I think it's more prevalent in these the suburbs of the city. And just like he said, they have done so much. Yes, they have tried a lot in the city center, but going out to the suburbs, it's so disheartening when you see people who are supposed to be well enlightened. You see people who even come to the city center to work, but when they come into the city center, they observe all the protocols, they wear the face masks, they observe social distancing. But when they leave the city center for crying out loud, you see them relapse. I mean, go back to their old ways. So I think we need to still do more. We still need to do more. Apart from the issue of enforcement, which I think may have to do more with the stick approach. I think we also still need to do more of enlightenment. Like medical professionals and so on and so forth. I was even surprised sometimes. I walked into some of my colleagues' establishments. You see that some of them do not even observe the no mask, no no entry. So a situation whereby patients walk into such facilities and you are so lackadaisical about those care, you do not enforce no face, no mask, no entry. You do not enforce people using hand sanitizers, washing your hands appropriately. I mean, people are coming away with the wrong notion that okay, if the medical professionals are also losing touch with all this, that means they're also free to do as they like. So I think we also need to keep up the fight.
Sure. All right, Atai Hara, how would you say the various measures adopted by government so far in helping mitigate the spread of COVID-19 in Nigeria? How well do you think those measures have been utilized?
No, I think the measures from the health practitioners really help to guide us, because we must not forget that when COVID-19 broke out at Wuhan in China, we all saw that. We must be very, very realistic about. We saw that when it actually got to Europe, Germany, Italy, Spain, and others, we saw corpses. When it got to the United States, till date, they are still feeling the pinch very badly and are still burying their dead, despite the fact that they are in a very tough election here. When it got to Brazil and some other part of Southern America, we saw that. In southern part of Africa, where we had very cold weather, we also saw that in part of South Africa and some other areas within the African continent here. I think the measures the health sector workers actually gave us, for many of us who are not in the health profession, they told us very clearly, see what is happening and how their colleagues are battling it, and how some of their health workers are also even going down to the graves when they were fighting COVID-19 as heroes in the pandemic process here. They told us that, look, we must do all of this. They guide us, they protected us, they ensure that constantly they drive the process of leading to tell us. Most of the health practitioners and others here within government and outside government spend time to conscientize us, and I believe strongly that the measures we put in place, at first we had complete lockdown. The lockdown helped to create heavy awareness. There was intense pressure to open up, but thanks to the persons who are there within the health sector trying to guide through, then we saw very painful deaths in quote now in higher places. Prominent Nigerians actually passed on during the COVID-19. They came down with COVID-19, or they had comorbidity, whatever, but COVID-19 is also inclusive, and they actually passed on to the great beyond. In all of the process here, I believe strongly, from my own conviction here, that the measures put in place actually helped us, and it was able to hold back. We shut our airport, although not as quickly as I had expected here, but at least we had got it in, it came in, but we shut the airport at the point we did, and that also helped for persons who may likely bring in more cases in here, and try to do contact tracing, how to manage the ones we have in-house here. And there was so much work, and the government measures, sadly and painful, the economy shrink. Some of the budgets we have had into COVID-19 to actually manage the pandemic here, we had to go for a reverse budget here. But in the whole of this, I believe we did what was right under the circumstance, and the government and the people, let me refer to what Dr. raised here, the government and the people in a very strong collaboration here gave COVID-19 a very tough fight. And the barriers, the corpses, the graves we saw across the world, we never saw such magnitude here in Africa, or in Nigeria to be precise.
Sure. All right, Dr. Iheme, while the ongoing global efforts in generating a vaccine for the virus is showing promising results, what is Nigeria's, in your view, contribution so far to the rest of the world in this fight against this pandemic? Well,
I think Nigeria has also been, as much as possible, while we're also trying to, as much as possible, maintain the case fatality, the recommended case fatality figures from all the efforts the Nigerian government is putting in. I think Nigerian government is also trying to encourage a lot of researches. Okay, if we cannot produce vaccines, all right, because of maybe the cost intensiveness and everything, I mean, we also could also look at other measures. There are also the herbal practitioners that are also being encouraged to come and submit all their products for all forms of documentation and researches and studies. I think a lot of them are coming up. And then, I'm sure the findings, NCDC and all the relevant bodies, pharmaceutical bodies, should be able to come up with what the state is at the moment as far as those findings are concerned with the herbal products. But as far as the other parts of the medical, I think we are doing our best. I mean, containment and all forms of sensitization But if it's as per, we are talking about the vaccines, and I'm not sure we are doing much in that regard.
Yeah, certainly still some way to go. All right, the program is Nigeria Today, and we are reviewing the COVID-19 phase 2 ease of lockdown. We'll take a quick break now. Do stay with us. We'll be right back.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
All right, you're welcome back. If you are just joining us, the program is Nigeria Today, and we are reviewing the COVID-19 phase 2 ease of lockdown with our guests, Dr. Iheme Ogbonnaya, consultant, family physician and medical director, Prime Care Hospital, Gwarimpa, and the chairman, FCT Ministerial Task Force on COVID-19, in person of Atta Iharo. Some experts opine that to have a possible end of this virus, another lockdown may seem the right solution. What's your take on this? Is this feasible at this time, especially with the economy in mind?
I think from our own perspective here, for now, we have not gotten a second wave, let me use that word now, and for now the economy is slightly struggling. And what I think is appropriate here, and which I had shared with some of my friends from the medical profession, is the need for Nigerians to own the process, and that is what we should be doing, like what we did initially when we had the first index case coming to the country here. Almost everywhere, everyone bought sanitizers, everyone almost bought face masks. Anywhere you go, nobody is shaking hands. There was real intense social distancing. I know at a certain point, as an enforcement officer, my wife actually convinced my kids to see me as coronavirus himself. Whenever for a month or so, they did not go home. When I arrived home, I know my kids opened the gate and rushed back and really felt that I should go and take my bath, steam, before anybody could even come close to me, because I was really very much exposed then. I think if that consciousness is in our minds and we are going out every day, and no matter the amount of COVID-19 cases we have, we are likely not going to get infected. But in a case where we don't have that, we may likely. And when it comes to the issue of having a second lockdown, it will really be very, very tormenting. I must say that very clearly here for people like who own nightclub, particularly in Abuja, the city center, and other areas here, who have not been in business for over 6-7 months. Those of them who even have bars, they've not been in business. The parks, the children parks, and others are allowed. I think the PTF allowed them to open today on the ground. They will only open and have outdoor activities here, and they are coming for about 5 months. Many persons have already been laid off. When you now close it down again, I think this time around it will be a case of the biblical case of Ella Lama Sabatani, and that may not be appropriate.
Certainly there will be a revolt probably if there is another full lockdown. All right, Dr. Iheme, as against what is obtainable in other climes with the numbers Nigeria has recorded so far, would you say that Nigeria has been lucky or needs to boost testing capacity to know just how much of the population has been infected?
Okay, I should think it's a combination of both factors, luck, and then the fact that we also need to improve our testing capacities. Now, what do I mean by luck? I mean, we have actually been talking about emphasizing so much about the virulence of the virus. I mean, you can look at the situation whereby most countries, the case fatalities are in excess of 5%. Here we're talking about just 1%. I mean, with all their technological sophistication and everything. So I should think that probably the virulence we have been talking about, and then as well as the environmental factors, plus or minus the genetic factors in us, may have also contributed so largely to the virulence, as well as the lesser case fatalities and so on, and whatever you have, what you may have, as far as the virus is concerned. So coming to the second point, yes, I was, even with the fact that we're having about 68 molecular laboratories that, PTF counted as part of the achievement, as part of, COVID-19 containment. I was worried about the last statement when, I think it was the health minister who was, complaining that the testing capacity has really gone down. I mean, due to factors we don't know, either Nigerians are not coming up for tests and so on and so forth. So we are looking at a situation whereby we are still looking at, the cases are going down and they are not being detected. So that could also contribute to the fact that we are having lower values. That could also be the fact that, okay, many people are not coming out to get tested. So that could also contribute to lower values. You hear about deaths who are not reported to the hospitals. I mean, could those also have counted, against us as far as the statistics are concerned? One will not say with all assurance, unless and only if those tests, the numbers of testings are increased, then one can say for sure whether the dwindling values are as a result of the virulence, issues of virulence, or has to do with the poor testing.
Sure. Staying with you, Dr. Yeme, there has been a debate as to the potency of unorthodox medicine and the part it plays in boosting the immune system. Do you think trado medicine or local herbs play a vital role either as a vaccine creator or immune booster?
I think their place remains as immune boosters, immune modulators. Vaccines are, when it comes to technology, vaccine technology, it goes beyond what many of us may think about, when we talk about the herbs and so on and so forth. Vaccine is a deliberate science. The development of vaccine is a deliberate science where part of that virus has to be isolated and developed and are now used against itself, either it's attenuated or killed, as the case may be, and then used against itself. So I don't think our drugs, our herbal drugs, will have any place, when it comes to vaccine development. But they could, as much as possible, go ahead towards boosting these person's immunity, and especially as much as possible help to either to prevent or to fight the disease, as the case may be.
All right. Atai Haro, some have argued that most countries are compromising the health of their nations for economic reasons by easing the lockdown, while COVID-19 figures clearly are still on the rise. Just give us your take on that.
I think what from my own perspective here, those who are arguing that may actually not go out on the field to actually meet persons here. I have met persons who lament, who weep, who cry. I met a particular lady, one of Abuja's biggest, center for recreation, very wonderful amusement park in Abuja. They've been out of business for about 6 months here. And the lady shed tears, not because of her, she could feed her family, but because of the staff she had to lay off. No one is seeing the picture of those families sharing tears and apparently dying of hunger. What the federal government is doing with the guidance of the President and Commander-in-Chief, President Muhammadu Buhari, is a lot commendable here. We cannot say because of because of the fact that we're fighting a pandemic that we are also, under which we are doing very well. We have to show that we are not compromising the economy at all. That's my own take here. I believe very strongly going forward here that we need to start to look at ways, like I said before, if the people own the process, you can even walk through. That's what the doctors are doing. They treat the patients with COVID-19, but because they own the process, they are fully kitted, fully protected. They go in and treat the patient and come back. The patient will recover. They themselves will not get infected. We just need to own the process, and we must own the process, overcoming all the deceptions that actually becloud our mind and paints a picture of disbelief. If we own the process, we can open up everywhere, and nobody will come down with COVID-19.
Sure. All right. That's all time allows us to take, but your point has been certainly well received. Atai Haro, Chairman, Task Force on COVID-19. Thanks for Ministerial Task Force on COVID-19. Thanks for once again sharing your thoughts and perspectives with us on this topic.
Thank you very much for having me.
And thanks also to Dr. Iheme Ogbonnaya, consultant family physician and medical director, Prime Care Hospital, Gwarinpa. Thanks also once again for being with us.
Always my pleasure.
All right, and thanks to you out there for watching. And do remember, Nigeria Today airs every weekday at 7:30 in the evening. You can also watch this and other editions on youtube.com/NTA News 24 Hub. I am Dennis Adegunloye. Thank you for watching and see you next time.